Next, we're going to hear from Dr. Michael Margolis. There he is.
Good afternoon. Just got to see how this thing works. My name is Dr. Michael Margolis. I have been a dentist for 28 years, and through the years I have seen how mercury fillings destroy patients' health and lives. The American Dental Association claims that once amalgam fillings, also known as mercury fillings, are placed in a patient's mouth, the mercury is stabilized and safe. I am sure you have heard and will hear testimony today that is not true, that mercury fillings emit vapors into the mouth after they are placed. I am here today to show you that mercury also escapes through the teeth, bones, and gums, causing health problems for patients. My time is limited, so I cannot tell you about all the hundreds of patients I have treated who have been damaged by the mercury put in their mouths. However, I am here to show you 3 patients who are representative of the patients who have had mercury leaching into their bones, gums, and teeth, and the health problems they have had because of it. Susie had an amalgam filling that leaked into the bone and gum above her upper right first molar. You can see the mercury coming through her gums, resulting in what we called a mercury tattoo. The only way to get rid of the mercury is surgically removing it from her gums and bone. You can see the mercury filling in the extracted tooth, but I also had to go into the extracted site and removed the remaining mercury filling pieces that had migrated from the tooth into the bone and gums. In another tooth, you can see the mercury filling deep within the center of the tooth. You can see from the x-rays that the mercury has moved into the jawbone beyond the tooth. Because of the mercury leaking from her tooth into the bone and gums, she developed breast cancer. Although she had a lobectomy, the cancer has spread through her body, and she has now been diagnosed with terminal lung cancer. Julie is another patient who had mercury leaching from her teeth into her gums and surrounding bone. In Julie's panoramic film, the teeth and the mercury-filled teeth look normal. However, in this periapical x-ray of the lower right third molar area, this area right here shows mercury that has leached into the bone. Not very clear. This is a picture of the same area that has been surgically opened. You can now clearly see the black dot in the bone. This is mercury. It is not in a tooth, but leaked from the tooth into the bone. There is no way to guarantee that this will not happen. It can happen to any patient with the mercury filling, and it happens over and over and over again. Once I remove the affected bone, you can clearly see the 2 black dots are clearly embedded in her bone. Julie, who was a collegiate athlete, suffered from toxic mercury elements spreading through her body. Today, Julie walks with the aid of 2 canes. She is now crippled. Marianne came to me diagnosed with mercury toxicity. She had 14 mercury fillings. If you look at the tip of the upper right canine, there is a mercury filling outside the tooth. Marianne suffered from chronic fatigue, fibromyalgia, incoordination, mental confusion, neurological failure, high blood pressure, thyroid failure, liver failure, and a failing immune system, and she was unable to walk through a metal framed door without receiving a physical electrical shock. Unusual multiple symptoms. Here is the same tooth in a periapical x-ray with the mercury filling clearly outside the tooth into the bone.
Doctor, you have 20 seconds.
Here is Marianne. She wants every one of you to know the story, how she suffered from how well she properly removed from all her mercury fillings. Today, she's able to live a normal life. The FDA's own mission proclaims that the FDA mission is to promote and protect the public by helping the safe, effective products reach the market and monitoring products for continued safety after they are in use. By making dental amalgam mercury fillings a Class 3 device, manufacturers of these toxic fillings would have to scientifically prove the safety of their products.
Thank you. Thank you.